Hi everyone, welcome back to our channel. Today we will discuss about the most important key points for any nursing exam. Let's start. Normal ICP. What is the normal ICP? 5 to 15 mm of Hg. First sign of hypovolemic shock is tachycardia and last sign of cyanosis. First sign is tachycardia. Next, most specific sign of myocardial infarction is elevated troponin I or T. Next, drug of choice in status epilepticus is IV, lorazepam or diazepam. Next, antidote of magnesium sulfate toxicity is calcium gluconate. Next, which position after spinal anesthesia? Spinal with pillow under the head. Normal amniotic fluid at the term 800 to 1200 ml. Placenta previa hallmark sign is painless vaginal bleeding. Abruptio placenta hallmark sign is painful vaginal bleeding with rigid uterus. First reflex to appear in newborn is rooting reflex. First permanent tooth erupt first molar. Normal CVP is 4 to 10 cm H2O. Primary prevention example is immunization. Secondary prevention example is screening. Tertiary prevention example is rehabilitation. Universal blood donor is O negative. Universal plasma donor is AB positive. Oxygen flow for the nasal cannula is 1 to 6 liter per minute. For the COPD patient, we used the 1 to 4 liter per minute. Oxygen flow for the simple face mask is 6 to 10 liter per minute. Oxygen flow for non-rebreather masks is 10 to 15 liter per minute. ORS osmolarity according to WHO is 245 milliosmol per liter. Best indication for renal function is serum creatinine. In CPR, compression and ventilation ratio is for the adult is 30:2. For the child 30:2. If single rescuer is 2 rescuer, then 15:2. For the neonate 3:1. CPR rate 100 to 120 per minute. Depth of the compression in adult is 5 to 6 centimeter. For the infant 3 to 4 centimeter. Glasgow Coma scale minimum score is 3 and maximum score is 15. Eye opening, verbal response and motor activity EVM. Short form we can say EVM. Total score is high, maximum score is 15 and minimum score is 3. Next, eclampsia drug of choice is magnesium sulfate. In anaphylaxis, first drug adrenaline is 0.3 to 0.5 mg in IM. Incubation period of measles is 10 days. Incubation period of chickenpox is 14 to 16 days. Incubation period of hepatitis A is 2 to 6 per weeks. DOTS is the therapy for the tuberculosis. Mantox test is rigged after 48 to 72 hours. First line drug of TB is rifampicin, causes orange red urine. Next, Cleheure-Bathek test detects the feto-maternal hemorrhage. Knuckle transfluency screening is done in 11 to 14 weeks. Folate prevents is neural tube defect. Protein energy malnutrition with edema seen in the kwashiorkor. Protein energy malnutrition with severe wasting is marasmus. Vitamin C deficiency causes the scurvy. Vitamin D deficiency causes in the children is rickets. Vitamin K is essential for the clotting factor of 2, 7, 9 and 10. Lithium toxicity. Early sign is tremors. Schizophrenia hallmark symptom is delusion and hallucination. Mini mental status examination maximum score is 30. First line drug in depression is SSRIs, example fluoxetine. Next, Freud's structural theories id, ego and superego. Kubler-Ross stage of grief is dabda, denial, anger, bargaining, depression and acceptance. You can remember dabda. Denial, anger, bargaining, depression, then acceptance. Next, nightmare emphasized involvement theory. Nightmare emphasized theory given by the involvement theory of nursing. Orom's theory, self-care deficit nursing theory. Normal potassium level is 3.5 to 5.0 MEq per liter. Hypokalemia in ECG seen is U wave. Depressed U wave in hyperkalemia seen ECG seen is tall peaked T wave. Hyponatremia sign is confusion and seizure. Normal serum sodium level is 135 to 145 millicu per liter. Normal serum calcium level is 8.5 to 10.5 mg per del. Trouser sign and chopstick sign indicates the hypocalcemia. Normal hemoglobin for the female is 12 to 16 gram per del. For the male 13 to 18 gram per del. Normal WBC count is 4000 to 11,000 per mmq. Neutrophilia indicates bacterial infection. Next, lymphocytosis indicates the viral infection. Eosinophilia indicates allergy, parasitic infection. Next, ESR increases in inflammation, TB, chronic infection. Normal platelet count 1.5 to 4.5 lakh mm per cube. Thrombocytopenia, risks in bleeding. PT-INR monitors for the warfarin therapy. APTT monitors for the heparin therapy. Antidote of warfarin is vitamin K. Antidote of heparin is protamine sulfate. Antidote of digoxin is digoxin specific antibody is also digibidine. Antidote of benzodiazepines is flumazenil. Antidote of opioids is naloxone. Antidote of organophosphorus poisoning is atropine plus pralidoximide. Antidote of iron poisoning is deferoxamine. Antidote of cyanide poisoning is amyl nitrate, sodium thiosulfate. Antidote of acetaminophen poisoning is N-acetylcysteine. Antidote of methanol poisoning is ethanol or fomepizole. Normal urine output is 0.5 to 1 ml per kg per hour. Oliguria, when the urine output is less than 400 ml, is known as the oliguria. Anuria, when the urine output going less than 100 ml per day, is known as the anuria. Next, polyuria, when the urine output will increase greater than 2500 ml, is known as the polyuria. Best indicator of dehydration in child is weight loss. Fontanelle closure, anterior fontanelle closure is 18 months, is called as the brigma, and posterior fontanelle close in 6 to 8 weeks is called as delta. APGAR score is taken at the 1 minute and 5 minute. APGAR maximum score is 10. Normal respiration rate for the newborn is 30 to 60 per minute. Normal respiratory rate for adult is 12 to 20 per minute. Common cause of maternal mortality in India is postpartum hemorrhage. Most common cause of neonatal mortality in India is prematurity and low birth weight. First vaccine given at birth is BCG, OPV and hepatitis B 0. Next, measles vaccine given at the age of 9 months. Vitamin A prophylaxis 1 lakh IU at 9 months. It's very important. Then 2 lakh IU every 6 months till the 5 years. Cold chain is maintained at 2 to 8 degrees centigrade. Vaccine stored in freezer OPV. Vaccine never frozen BCG, DPD, TT, hepatitis B. RCH Reproductive Child Health Program full form is Reproductive and Child Health. ASA worker incentive based worker in 1000 population in rural area. Sub-center covers population in 5000 in plain, 3000 hilly, tribal. PHC covers population is 30,000 in plain, 20,000 is hilly or the tribal area. CHC covers population 1,20,000 in plain and 80,000 in hilly or the tribal area. Cold sterilization agent is glutaraldehyde 2%. Autoclave used for the 121 degree centigrade 15 lb pressure 15 to 20 minutes. Hot air oven 160 degree centigrade for 1 hour. Best method for sterilizing heat sensitive article is ethylene oxide gas. Biomedical waste yellow bag is human anatomical waste, solid waste. Red bag used for the plastic tubing and catheters. White translucent container used for the sharp needles and blue bag container used for the glassware metabolic implants. Needle stick injury. First step, if needle stick injury occurs, then we have to wash the sides with soap and water. Don't squeeze. Post exposure prophylaxis for HIV within the 2 hours. Continue 28 days. Continue 28 days. Universal precaution is hand hygiene. Best indicator of hospital infection is rate of nosocomial infection. Most common hospital infection is UTI due to catheterization. Nosocomial pneumonia most common organism is Pseudomonas. Next, MRSA drug of choice is vancomycin. Clostridium difficile causes the pseudomembranous colitis. Airborne precaution should be taken N95 masks, negative pressure room. Droplet precaution is surgical mask 3 feet distance. Contact precaution should be used gloves and the gown. Hand washing minimum time is 20 seconds. World Health hand hygiene 5 moments is before touching the patient, before aseptic procedure, after body fluid exposure, after touching patients, after touching the surroundings. Next, pulse pressure means systolic BP minus diastolic BP. Normal systolic BP is 120 and diastolic BP is 80. So normal pulse pressure is 40. Narrow pulse pressure means seen in the cardiac tamp node and the shock. Wide pulse pressure is the aortic regurgitation. Backstride cardiac lymph node is seen in the hypotension, muffled heart sound and JVP rise. Classical sign of pneumothorax is absent breath sounds on affected side. Tension pneumothorax emergency. Do the needle decompression in the second intercostals MCL. Chest tube inserted at the fifth intercostals mid-axillary line. First sign of the hypoxia is restlessness. Cyanosis appears when hemoglobin reduces greater than 5 gram per del. Normal SaO2 is saturation of oxygen is 95 to 100 oxygen level. Normal PaO2 oxygen level is 80 to 100 mm of Hg. Normal PaO2 is 35 to 45. Metabolic acidosis. In metabolic acidosis, decrease the pH and decrease the bicarbonate level. In respiratory acidosis, ABG seen in the decrease the pH and increase the PaCO2. In metabolic alkalosis, ABG is increase the pH and increase the bicarbonate. In respiratory alkalosis, ABG is increase the pH and decrease the PaCO2. Next, common cause of metabolic acidosis is diarrhea and diabetic acidosis. Common cause of respiratory alkalosis is hyperventilation and anxiety. CPR sequence in CAB: circulation, airway, and breathing. Next, defibrillation energy is 120 to 200 joule. Fast shock in ventricular fibrillation, pulseless VT is defibrillation. Atropine dose in bradycardia is 0.5 mg IV. Repeat quarter 3 times after 5 minutes, maximum 3 mg. Adenosine dose in SVT is 6 mg rapid IV push. In 12 mg if needed. Dopamine use in the shock and hypotension. Noradrenaline use in the septic shock. Dopamine low dose effect renal vasodilation. Shock index means heart rate by systolic blood pressure is normal level is 0.5 to 0.7. In hypovolemic shock, first line fluid is the normal saline. Crystalloids, normal saline RL. Colloid example is dextran and albumin. Rule of 9. Adult for burn is the head 9%. This is a person. Head is 9%, each arm 9%, 9, then 9, then each leg 18%, perineum 1%, back 18%, and front 18%. So total 100%. Parkland formula is 4 ml into percentage of TBSA, total body surface area, into body weight. First 8 hours we have to give the half of the fluids, then next 16 hours we have to give the half of the fluids. First sign of septic shock is fever and the tachycardia. Earlier sign of increased ICP is the restlessness. Cushing tried bradycardia, hypertension and irregular respiration. Mannitol is used to treat the raised ICP. Spinal cord injury above the T6 risks as the autonomic dysreflexia. Autonomic dysreflexia hallmarks is hypertension plus bradycardia. Commonest site of cervical fracture is C5 to C6. Guillain-Barré syndrome hallmark is ascending paralysis. Myasthenia gravis test is Tansilon test. edolophonium. Myasthenia crisis causes the under medication. Cholinergic crisis causes the over medication. Alzheimer neurotransmitter decrease the acetylcholine. Parkinson neurotransmitter is decrease the dopamine. Parkinson triad is tremor, rigidity, bradykinesia. Levodopa given with carbidopa to prevent the peripheral metabolism. Stroke most common type is ischemic stroke. Hemorrhagic stroke main cause is the hypertension. Fast test for the stroke: face droop, arm weakness, speech problem, time to call. Antidote for the TPA is aminocarporic acid. Normal ICP monitoring side is ventricular. Thank you everyone. Please, if you are liking the content, please like our video and comment and share and subscribe our channel. Thank you everyone.